views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello everyone, welcome to a new LOTF season. First episode, we are here with Emily and Rusan. We are in the Yankee Stadium, which has become a mass site for COVID vaccines. We are with a pediatric intensivist, Dr. Nunez.
We are currently at the urgent care facility to talk about COVID-19 and the vaccination process. We will be talking to Dr. Guevara, who will be answering questions about our community. We also have a special message for VP Ruben Diaz Jr., so don't go anywhere.
So we're here today because I heard that you guys had some questions about COVID vaccine. And as you guys know, I've been working a lot with COVID patients and now, testing and now giving vaccines to patients. So you have a question for me?
Yes, I do. My question is, do you think people from the ages 2 to 4 should get the vaccine?
It's very interesting that you asked that question because what happened is that most of the people that got very, very, very sick and actually hospitalized and died were elderly people and adults. So the kids actually got infected, but they did not have a high rate or incidence of hospitalization and of death. And in the majority of the studies that they did, none of the studies were done with patients with children. They all were done on patients that were 16 years of age and older. So like we have several vaccines, and the Pfizer was the only one that took into account patients of 16 years of age.
Are there any serious symptoms of the vaccine?
So that's a great, great question. A lot of people are very, very worried because they think they're going to get sick with the vaccine. So what happens is that there are different types of vaccines, right? And the vaccine, when they give you the vaccine, your body is fighting against that protein they put inside of you because it mimics the virus. And they're not putting the virus in there, it just mimics it. So then you're producing antibodies. When you produce the antibodies, it's like your body's like fighting. So you might feel a little bit tired. You might have a little bit of fever. Your arm swells a little bit. And besides that, there have some studies that shown some allergic reaction, but that's very, very minimum. But other than that, that's what you feel.
So how many vaccines are there?
So there are many vaccines. I know about 8 already, but here in the United States, we only have 2 approved, which is a Pfizer and the Moderna. But there's 5 more. They're all different. Most of them are 2 shots, except one that's just 1 shot.
What are the different types of vaccines?
So there are different companies and different countries. They're trying to make enough vaccine for the entire world. Just not one company can make so many vaccines. So here, as I said, we only have 2 approved, which is a Pfizer and the Moderna. And all the other countries have different type of vaccines that can be used. Right now, we're going to have another vaccine, is a Johnson & Johnson. The difference between that one and all the ones that we have right now is that the Pfizer and the Moderna are 2 shots. The Pfizer is 21 days in difference, and the Moderna is 28 days in difference. And the Johnson is just 1 vaccine. The issue with the Johnson & Johnson is that in what percent it's going to protect you from getting the coronavirus is only about 60 to 72%, while the Moderna and the Pfizer is over 90%, which is great. So that's why we are giving right now the Moderna and the Pfizer in most of the places.
Do you think these companies may test on younger kids or teenagers?
Yeah. So I'll tell you about each one of them. The Pfizer did test on ages 16 and above, and they used about 44,000 people. Moderna did above 18 years of age and only did 30,000 people. So all the other vaccines were always done in adults.
Based on the studies, have the vaccine been working?
Yes. So based on the study, more than 90%, the Pfizer and the Moderna is effective more than 90%, which that means about 95%, which that means that it would actually make sure that you don't get sick. And if you get sick, you're not going to get severely sick that you're going to die from it or go to the hospital. The most important thing that we have to remember is that even though you guys get your vaccine or your family members, anybody, still you must wear your masks. You have to be careful when you go, in close surroundings. You have to wear gloves. You have to keep distance because not everybody, first of all, is vaccinated. So this vaccine is going to prevent you from getting sick, but that doesn't mean that you cannot spread the virus to anybody else if you get sick. So if you have the vaccine, you can still get sick from coronavirus, but you're not going to die from it, or you're not going to get very, 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 very sick. So that's very, very important to remember. Okay. And have you heard any myths out there about the vaccines? A lot of people talking about they don't want to take the vaccine. Have you heard about it?
Yeah.
What have you guys heard about the vaccine? That people don't want to take it.
I've heard that you get like really bad acne. Like if you have acne already, it worsens it. And I saw a picture and I was like really scared because like acne is not something that you should like.
Yeah. So remember, it's not only, the thing is that people are correlating one thing, to everything to the vaccine now because you're getting the vaccine. Remember, you have also masks. Remember, the mask also causes a lot of acne. So people are just wanting to correlate things with the vaccine because people don't understand what's going on. People don't understand the vaccines. They think that you're getting the virus. So remember, some of the vaccines are created with the little piece of the virus when the virus is dead. Actually, one of the vaccines is created like that. But the Pfizer and the Moderna, they're not. They're created with something called mRNA. And what that does is that it goes inside your body, and that tells your body to produce a little protein that looks like the coronavirus. So when the body sees that, it says, "Oh, that doesn't belong there. Let me fight against it. Let me create antibodies." And then when you get the coronavirus, the real one is going to say, "Oh, I know you're not supposed to be there. Let me attack you, and you're not going to get my body sick." So that's what happens. Okay, so it's not that you get, it's not that you're going to get acne or people say, "Well, I faint, people die." No, there's a lot of safe studies. All these trials took months to take. They went to secure organizations that actually took a look at all the data, and they passed through the FDA, which is an organization that's most important for us in order for us to get the vaccine.
Should people with COVID or that don't know COVID, that they have COVID, get the vaccine?
Yes, they should. They should because they don't know how long their immunity is going to last. So it's very important that they still get the vaccine so they can get more immunity against, because you can still repeat it. You can still get it again, right? So, right? So it was so nice talking to you guys today. I hope I was able to clarify some questions. And please, stay safe. Make sure you tell your family members to get their vaccines because the vaccine is safe and it's proven scientifically. Remember that. It is safe, okay? So thank you so much for joining me today.
Thank you.
Thank you. Bye, guys.
Bye.
Hi, I'm Bronxboro President Ruben Diaz Jr., and I just wanted to take this time to commend and congratulate and recognize the good work of Leaders of the Future for all that you're doing in disseminating and getting message and information, especially around health, to the youth. You're doing this news for the youth, by the youth, especially during these trying times, during this day and age where the COVID virus over the last 11, 12 months has totally ravaged our society. It's devastated many of our families. We've lost loved ones in a large scale. We've lost a lot of jobs. We've seen tens of thousands of people who fall sick. Each and every single one of us, and each and every single one of you, either know somebody or have a family member that's been adversely affected by this COVID virus. And we know that the COVID virus is really just indicative of some of the healthcare issues that already pre-existed in our communities. And the only way that we're going to turn this around is by having you be cognizant and you be the voice and you be the conscience, so that we can eat better, so that we can exercise, so that we can do more appointments and checkups in our doctors. You have to be the voice of reason and conscience in your families, especially now that we have the vaccine. You know, once upon a time, your parents, your grandparents, your abuelitos and abuelitas, they were the ones who took you to get vaccinated before you started school. This is the time now where the young people, you now go to them and say, you looked out for me, now I want to look out for you. This is what I did with my parents. This is the only way that we're going to get back to some level of normalcy. This is the only way that you're going to get back to educating yourself with the education that you deserve. This is the only way that you're going to be able to have the socialization as young people that has been stolen from you from this enemy that we cannot see, that we cannot smell, that we cannot feel, except until it's too late. When you look at the history of crisis, not only in the United States, but throughout the planet, of turmoil and upheaval, yes, we always read about the big names who were the leaders of the movements, but they couldn't do it without youth, without young people in mass. And now more than ever, your voice, your energy, your commitment, your resolve is exactly what we need in order for us to progress and get out of this dark moment into a better future. As the borough president, I ran 26 years ago for the New York State Assembly as a young 22-year-old because I felt that young people were not represented enough. I felt that young people did not get the consideration of elected officials. And I was practically alone at the time. But now, fast forward, as I step off the stage and I'm headed towards my retirement, I am elated. My heart is filled with joy. I feel so comfortable and confident that the future of the Bronx and the city of New York is in great hands with people like all of you, the leaders of the future. It is for that reason that I want to say hello. It's for that reason I want to say that I'm proud of the work that you've done and continue to do. And it's for that reason that I want to add a little bit more of weight on your shoulders. Your job has not even begun yet. And so continue the good work, and I'll see you all soon. Peace.
Hi, we're here with Dr. Ernesto Guevara. I am going to ask him a few concerns of the community about the COVID-19 vaccine and just some information about the COVID-19 vaccine. We are going to be talking to him today and asking him the questions that all of us have. But first, would you please introduce yourself?
Hello, I'm Dr. Ernesto Guevara, coming from the Bronx and Dr. Urgent Medical Care. I'm a family physician working in urgent care here as well as another hospital in the area. Here at Dr. Urgent Medical Care, we're doing COVID testing, we're seeing urgent care patients, and also we're starting to vaccinate patients for the COVID vaccine. I've been practicing in the Bronx for over 11 years, serving our community, trying to see this community's health improve and meet the needs of the community members who are most in need. And it's a pleasure to be here today.
We are going to ask him some questions about the COVID-19 vaccine today.
Sure.
So, do you think the pandemic will be ended if we vaccinate people? And why do you think that the vaccine is necessary?
A vaccine is necessary, like all vaccines, to help control whatever it is that we're vaccinating against. So in this case, the coronavirus, the COVID-19 virus, is what we're trying to prevent the spread of. And we're doing that by multiple measures: hand washing, face mask wearing, distancing, but also the vaccine. The vaccine itself is not the only measure. It's what we're trying to do to have the majority of the population vaccinated, to have what we call herd immunity. And that will help to definitely address the pandemic. But the vaccinations alone, unless we reach a certain amount of people vaccinated in our community of over 80%, it won't be the end all to the pandemic. But it will definitely help us get to where we want to go.
Can I still transmit the virus if I'm vaccinated, or will I be fully vaccinated from the virus?
Well, the vaccine is, what we're talking about, what we're giving in our clinic is Moderna. Moderna and Pfizer both take 2 vaccinations before you get the immunity that we're looking for. The first vaccine will happen, and then a month later you'll have the second dose of the vaccine. The way that our immune system works is it has to recognize that vaccine, and it takes about a 2-week process for that to happen. So after the first vaccine that you get, that day you get it, you're not all of a sudden protected and you can go without your mask and without distancing and washing your hands. You will have to wait a couple of weeks for that immunity to develop, and then to have more of an effective vaccination, we need that second one 28 days later, about a month later. So to answer your question, you could potentially still transmit in that period that your system is trying to develop the immunity. But it's going to lower the chances of that happening, and it's also going to lower the effect of COVID if we do get exposed to it and get infected by it.
Okay. So, like other vaccines, can you still get COVID-19 after being vaccinated?
So the vaccine will, like the flu, if you look at it in that sense, you know that you can still get flu if you've had the flu vaccine, and we still have to have the flu vaccine every year because there's different types of flus out there. And we're learning about that now with this virus, that there's variants of it. So after the vaccination, you're going to be protected from having the severe symptoms of COVID. You could still contract it, but it's almost like the flu. You might not get the severity that you would had you not been vaccinated. But the idea is that it will, 1, help you to recognize the virus, fight it quicker by your own immune system, and if not, and you get infected, have milder symptoms.
So, what can we expect symptom-wise? And does it have anything to do with why little kids can't get the vaccine?
So the vaccine itself, as far as the response that our body has to it, after the vaccine, you can have soreness, you can have mild symptoms that are similar to like a flu, where you have body aches, fevers, and chills. The answer to why kids cannot receive the vaccine yet is more to do with research in that population, more so than the symptoms, because we expect everybody to have similar immune responses to the vaccine, adult or children. So it's not that the symptoms are so severe that children can't get the vaccine, it's just that we haven't studied it long enough in that population. And eventually that may be the case where the children will be able to be vaccinated as well.
There are people with underlying sicknesses, and there are people that are pregnant or planning to get pregnant. And these people have seen to be at risk more of getting infections and have had worse times with these infections.
Yes.
Do you think it's the same with the vaccine, and do you think it's safe for them?
So it's important that they get the vaccine. Just like the flu, you will see that people who have asthma and diabetes, those are the people who have the most complications once they're infected by the flu or by COVID. So it's important that people who have underlying medical conditions seek the advice from their doctors, but it is recommended that they get the vaccine as well. And as of now, we've opened up the phase for people with chronic medical conditions like asthma and diabetes and hypertension to get the vaccine, because those are the ones who have the worst potential outcome. Pregnant patients, as far as what we know, it's still being studied, but it's recommended based off of the type of vaccine that it is that they can get the vaccine if they want it. But with time, of course, with research, we're going to find out the effectiveness of this virus, the duration of how long the immunity will last to protect us, and if we will need additional doses like a booster or something annually, or to cover the variants that are out there, specifically like how we're talking about the flu virus and the flu vaccine, which is given annually.
Okay, thank you.
So it's important that people with underlying medical conditions get the vaccine.
So this vaccine is getting more and more accessible, as we can hear, and we can see that there are more and more hospitals carrying the vaccine. But is it free or not? And do you have to have an appointment, or can you just have a walk-in?
I've always been told nothing in life is free, right? Somebody's paying for it. But for you to actually go to get the vaccine, you're not going to have to pay any money, right? So that shouldn't deter people from getting the vaccine. People with insurance, people without insurance are coming to our clinic to get the vaccine. It's best that you make an appointment online, because it's all dependent on how many vaccines are available at that site at that time. And if too many people, the demand is greater than the supply, then a lot of people are going to be left out in the cold to that day. So it's important that they, one, go online to make these appointments, because it also determines the criteria when they answer the questions of who should be getting the vaccine first, and then as time goes on, who can get the vaccine after them. But it also assures that you won't be waiting in a line to come to find out that when you get to the front, there's no vaccine because there's no availability for it. There are different things that you can do to contact clinics and other sites, because sometimes at the end of the day, they might have extra vaccines that they can distribute to the community, so that way they don't waste them. But it's always best to contact the place where you're going first, whether online to make an appointment or by phone, before you go to get your vaccine.
Okay, so going off what you said about how people without insurance are also coming, can people without residency or without papers, the normal paperwork, come and get the vaccine as well, or are they restricted in any way, and do they have to give information?
From a health point of view, it's important that we all get vaccinated, that we get almost everybody vaccinated. And if you look at where undocumented people are in this situation, they're one of the most at risk. Also, they're one of the ones who are most within our community, with us, working alongside with us, working together, and we all need to be protected from this contagious virus. So it shouldn't be a deterrent from anybody, depending on your legal status or immigration status, to get the vaccine, and it won't be used against you if you do try to get the vaccine.
Thank you for being here today, and it was really a pleasure to be with you today and to ask you these questions about COVID-19 and the questions about the vaccine that all of us have. Thank you very much for answering our questions and our concerns.
Well, thank you for having me at any time. We're here for you. So this is the vaccine that we're using in our clinic, Moderna. We usually pull it out of the fridge and we have 12 hours once we uncap it to use it for that day. Usually the supplies that we have are a syringe and a needle. It doesn't matter the amount of the syringe that's there, but we're pulling 0.5 milliliters, which is right there, little small amounts from this vial. And we should get about 10 doses out of this vial, so 10 people minimum should get a vaccine from this. It's just like every other vaccine that you've been accustomed to. You want to make sure that your equipment's sterile. All these needles that are inside packages are sterile. Once they're open, they're then now able to be used. And we have an alcohol swab that we'll clean the area with first. We will withdraw with our syringe and needle 0.5 milliliters of this vaccine. Clean the person's arm, the deltoid area, right here, and to give them an intramuscular injection after the area has been cleaned properly. The injection usually is just a small pinch. If anything, a lot of people tell me they don't even feel it, and it goes in the arm within 2 seconds. After that, we'll make sure that there's no bleeding, and we'll just put a simple Band-Aid over the area. We observe the patients for usually 15 minutes afterwards just to make sure they have no reactions from this vaccine. Usually rashes or shortness of breath or any other types of alarming reactions should be dealt with immediately during that period of time. And we usually will have an EpiPen or some Solumedrol, which are medications that can be used to help control those reactions. Other than that, it's pretty much simple. It's like every other vaccine that you've known and have received, including the flu shot, and this shouldn't deter you from getting your vaccine. Hopefully that helped.
We are here to keep you informed. The fight is not over. Don't forget to wear your mask.
Thank you guys for joining. Hope to see you next time. Bye.